Good afternoon, everyone. This is Ashland KY Chiropractor Dr. Gary Dillon, and this is your Thursday video health tip of the week. We're going to talk about probiotics and cavities in kids. Going to encroach on the dentist's area just a little bit this week. Hopefully that doesn't upset them. I wanted to bring you information that we found on my doctor's resource on my website of a new study that says probiotics may prevent childhood cavities. Basically, we know there's a lot of things that may help cavities and health in general in babies. Breastfeeding babies helps. Breast milk tends to reduce acidity in the mouth and prevent the growth of cavity-causing bacteria. All right, keep sugar out of their bottles when you feed them. Bottles should only be used for breast milk, formula, or water, never juices or sugary soft drinks. Soothers or pacifiers should also be kept sugar-free, and honestly, get rid of those as fast as you can. Clean baby's gums. This is something that I didn't know when I was a new parent. Gently cleaning your baby's gums with a washcloth after feeding keeps gums healthy and limits the growth of harmful mouth bacteria. Now, this study that we're talking about in the probiotics was actually a pretty big deal. Nearly 82% of children who took the probiotic until age 1 had no cavities, while only 58% of those who took no probiotic were similar cavity-free. Now, this is not just the kids taking the probiotic. Let me read you the parameters of the study. Of the children from the original study, 113 had dental examinations at age 9 to measure the number of cavities, the amount of plaque on tooth surfaces, and levels of cavity-causing bacteria in the saliva. They also answered questions in an interview about diet, brushing, flossing, and fluoride use. Those exams and interviews revealed the following. Children who got the probiotics had fewer cavities than children in the placebo group. In particular, they had fewer cavities on surfaces between teeth, which are common because they occur in places where food frequently gets trapped, and that's hard to clean with brushing. Usually those are only seen on x-ray. Nearly 82% of the children who took the probiotic until age 1 had no cavities, but only 58% of those who took no probiotic were similar cavity-free. Although the amounts of plaque were similar in the two groups, children in the probiotic group had less gum bleeding, often caused by plaque buildup. Levels of cavity-causing bacteria were the same in both groups, suggesting that long-term benefits of probiotic supplements are not related to lasting changes in mouth bacteria. Sugar eating, brushing, and flossing habits were similar in both the probiotic group and the placebo group, but more children in the placebo group used fluoride. So, that kind of balances it out a little bit, but it seems like the probiotic was a little more effective than fluoride. And one thing I want to tell you this is the parents took the probiotics while they were pregnant with the children too. It wasn't just the children taking the probiotics. So we've discussed probiotics on these videos and some of my articles before, how important they are to overall health and your digestive tract. But here is another article that shows how important this is to health, even dental caries, as cavities are called. So definitely get on a good probiotic. And while we're talking about probiotics, let's touch on what kind, okay? You want a probiotic that's refrigerated. If you buy a probiotic off the shelf, you don't know how long it's been there, and you may be buying dead bacteria. You don't want dead bacteria because it doesn't do you any good. There's a few that doctors use. I recommend getting one out of your doctor's office, okay? If you're watching us on YouTube, please subscribe to our channel. If you're looking at this on Facebook, hit the like button for me. Or if you're on my website, www.dillonchiropractic.com, when you're prompted, please enter your name and email address, and we'll be able to deliver these video health tips to you once a week as promised. We never ever spam you, and there's always an unsubscribe link right at the bottom of the page. Again, this is Ashland KY Chiropractor Dr. Gary Dillon, and I look forward to next week when I can bring you another video health tip teaching you how to be as healthy as you and your family can be. Have a great weekend.